One aspect of our specialty that I'm very proud of in terms of recent developments is preimplantation genetic diagnosis, more commonly known as PGD. So PGD entails being able to biopsy an embryo in order to avoid transmission of a potentially deleterious mutation. And it's very powerful because you can essentially prevent known diseases from being transmitted down to a child. I remember one of my recent cases where both parents were found to be carriers of spinal muscular atrophy, SMA, more commonly referred to as. And unfortunately, in their scenario, they had already had a child affected with SMA. And this is a horrible and tragic disease where most children usually start off fine and end up dying between 2 and 3 years of age spontaneously, and it is absolutely horrific. When this couple came to see me, it was just they were devastated, understandably, and our heart really went out to them. But we were proud to say with these new breakthroughs, PGD, we're able to give them therapy definitively to help them build their family and really prevent them from going through further heartache. This patient went through in vitro fertilization electively, and that entails taking fertility medications to stimulate a woman's ovaries to develop multiple eggs, undergoing an egg retrieval process. The eggs are then inseminated in our embryology laboratory with a variety of different methods based on the male characteristics. Then the embryos are cultured to 5 days of development under very controlled environmental conditions designed to really mimic the interior of the fallopian tube. Once the embryos reached the day 5 or day 6 stage, then our highly trained embryologists perform specialized biopsies at a peripheral location of the embryo, and then the embryo is then cryopreserved. At that point, the biopsy specimens are sent off for analysis, and usually within a week's time, we get a thorough readout of each embryo in terms of the embryo's genetics. For example, the readout would say embryo 1 is a male and has this disease that we're trying to avoid. Embryo 2 may be a carrier, and so on. This is a very powerful technology that is essentially able to tell you whether a given embryo has the potential of either being a carrier for a disease or actually has the disease itself. In the case of my patient, we performed the IVF and PGD procedure, and we're fortunate to have unaffected embryos on that round, transfer the embryos back, and had a successful outcome with a child that was proven to be completely free of disease. And that's one of the most powerful applications of medicine, and in this case, preventing diseases from even ever occurring.